We want to turn now to this breakthrough in the treatment of breast cancer. A new study concludes women with early-stage breast cancer do not benefit from undergoing the extensive procedure of removing lymph nodes. And it's something that's actually been standard procedure for decades in the treatment of this disease. Joining us this morning with the details is Early Show medical correspondent Dr. Jennifer Ashton. And we should point out we're only talking about women here, not men with breast cancer.
Correct.
Because the study only looked at women.
Right.
What is so groundbreaking about this that it's being called a potential game changer?
Erica, what we're talking about is a procedure known as a lymph node dissection, which was the standard of care for treating early breast cancer. And specifically, we're talking about a lymph node here known as the sentinel lymph node. It is the watchdog lymph node of the cell. It's often the first lymph node to pick up cancer of the breast. In the past, when that lymph node contained cancer, a much more extensive removal of the lymph nodes in the armpit was done, which has significant risks. This study and others before it showed there was no survival benefit at 5 years and no outcome in the women who had the more extensive procedure. So the thinking is less is more. Why do a procedure if it doesn't markedly change outcome?
So then will this in fact change the treatment for those who've been diagnosed with early stages of breast cancer?
Many breast cancer experts are saying this will be a practice changer. Like anything, a lot more research needs to be done, but the results of this study are being described as interesting and provocative, potentially affecting 40,000 women in this country a year with early stage breast cancer. Potentially, it may make this procedure, the more extensive one, obsolete.
And so then that would be, so instead of then having that full lymph node removal, it would be something more akin to radiation and chemotherapy.
There will always be aggressive medical therapy, but in terms of the surgery, just the lump itself will be removed and just that sentinel lymph node, just one lymph node instead of many more.
Helps to have you break it down like that for us, Jen. Thanks.
Pleasure.